Good afternoon, good evening. This is Dr. Garais, your instructor for BIO104. And today's, there's two topics today. And let's go over the first one, lymphatic and immune system. I think it'll be, just do it this way. Yeah. So what are your lymphatics and how is that related to your immune system? And how does your lymphatics protect you against infection? Well, wherever there's an artery and a vein, there's also, of course, a nerve running around it. There's also another tube called your lymphatic vessels. These vessels are filled with lymph fluid, and these lymphatic vessels also have like these little way stations called lymph nodes. And of course, they have the lymph fluid has white blood cells in it, and we already know that white blood cells protect the body against infection. Another neat thing that the lymphatic vessels do is that it can take extra fat and extra fluid that's in your cardiovascular system, your arteries and veins, and like if there's too much fat or too much fluid in the arteries and veins of your cardiovascular system, the lymphatic system also bears the load of that as well. Because if we have too much fluid in your arteries and veins, you have a potential of getting edema, which is, remember, too much of a good thing, like fluid, liquid, becomes a bad thing. So, lymphatic system. Another thing that the lymphatic system and the immune system also does, and they're used interchangeably, is you have lymphatic tissue, I just mentioned, lymph nodes. You also have other lymphatic organs, such as your spleen, your thymus. Sometimes your bone is included in that as well. Immune system, we already mentioned, white blood cells, and of course, they fight pathogens or potential pathogen. If you recall your medical terminology, pathogen means gen, creation of, patho, disease. And that's bacteria, viruses, fungus, parasites, and also foreign body. A classic example is like asbestos getting in your lung. That's foreign body, and then if there's enough of it, it can be a potential pathogen. So the immune system, think white blood cells, think its function to like surveil your body and fight off any potential pathogens. And the lymphatic system is like a backup to the immune system. It actually takes the white blood cells to where they need to go. And those are the lymphatic vessels I mentioned. And the lymph fluid, of course, has it's kind of made up of the same stuff that plasma in your blood is made out of, but they also have white blood cells. And the white blood cells come in two types, granulocytes and agranulocytes. Well, your agranulocytes are your lymphocytes, and those are your T cells and B cells. The T cells are from your thymus, the B cells are from your bones, and your B cells, you may be familiar with them, they make antibodies. And they're called memory cells because they remember the last time you were exposed to that particular pathogen that made you sick, and it has a quicker response. Now, the other ones are, the other red white blood cells are your granulocytes, and those are your neutrophils, your eosinophils, and basophils. Okay, and these T cells, B cells, and those neutrophils, basophils, and eosinophils form up all the different types of white blood cells you have in your body, and that is called your white blood cell differential. You can see here what we were talking about earlier, that there's a pathway, and those are your lymphatic vessels, but all along this pathway you have these lymph nodes, and sometimes they call them lymph glands. Think of them as little like forward operating bases or way stations where where that lymph fluid with the white blood cells in it you know, you can get to a bad place quicker. So for example, let's say my patient here has a sore throat and maybe a little infection, maybe a little bit of pharyngitis, a little sore throat there. Well, instead of a white blood cell having to travel all the way, maybe from your thoracic duct all the way down here or from your bones, there's some already in the lymph node, so it'll go there. And like a forward operating base, other white blood cells, other immunogen troops can go in there. And that's why when you do have your sore throat, these lymph nodes here or lymph glands in the vicinity of your throat area will get swollen and sometimes even become painful. We can also not only detect pathogens, that's also another way we detect cancer as well. So for example, this patient here, if they had breast cancer, we'd be checking the axillary lymph nodes or the lymph nodes in my patient's armpit because cancer is not normal. It is considered a pathogen and your white blood cells will react to it. Now, these lymphatic ducts are the main places where the fat and the extra fluid will empty out into. The thoracic duct, of course, is in your thoracic or your chest cavity, and your right lymphatic duct, which drains into your right subclavian vein. And it goes, if they back up, you're going to get lymphedema. And remember, edema is too much interstitial fluid. You can get edema in your arteries and veins and in all different kinds of organs. You can also get edema in your lymphatic vessels, and that edema is called lymphedema. And you can see here how the majority of your blood, of your lymphatic vessels, all these little lines here. And oh, by the way, just like arteries and veins are colored red and veins are colored blue, lymphatic vessels are colored green. Not because they're green in real life, but that's the convention that medical textbooks use. And you can see here all the blood will drain, or the excess fluid and the excess fat will drain here, your right lymphatic duct. And here's your thoracic duct here. Mentioned T cells and B cells. Now, maybe you heard of T cells, T cytotoxic T helper. T helper, also known as CD4+ cell. Cytotoxic T cells or T killers, also known as CD8+ cells. And T cells make up what they call your cellular immunity. The T helper cells are antigen presenting cells, meaning that they kind of blow the whistle on pathogens. And then things like the cytotoxic T cells and macrophages and natural killer cells, they're the ones who I see the T helper cell as kind of like a whistleblower or a tattletale. They're the ones who chemically say, hey, this is a bad thing, we gotta go kill it. And who are killers? T cytotoxic, natural killer, you also have your macrophage as well. And B cells, I want you to think antibodies. And B cells create these cells called plasma cells. Plasma cells remember the chemical appearance of previously exposed pathogens, and then they create this Y-shaped protein called an antibody. And that's how you get a quicker reaction. And it's also the reason why we have vaccines, so that you get exposed to, not the full virus or the full pathogen, but an attenuated pathogen, typically a piece of their, their coat or their antigen, and that's how you make antibodies through B cells. MALT is mucosa-associated lymphoid tissue. I want you to think small intestine, Peyer's patches. You also have MALT in your tonsils and your appendix. because your tonsils are in your mouth. It's a very bacteria-laden and potential pathogen-laden area, and Peyer's patches as well in your small intestine. Your intestines have a lot of exposure to a lot of quote-unquote dirty things. And here's your Peyer patches, and this is an example of your small intestine. Tonsils, they're located, and if you take a good look at it, a picture of, why am I saying take a good look at the picture? Let's show you where your tonsils are in your throat. And if you see here, oh, you see here tonsillitis. You see on the sides of it, it's so swollen. But let's look at normal first. If this is your palatine tonsils, right? Because this is it's associated with your soft palate back here. This is your uvula, and of course your hard palate. But you can see here, they're relatively small, but then they can get very big and very infected and very painful. And of course, there's lymphatic tissue. Your appendix, right here, it's connected to your cecum, or the first part of your large intestine. This is your large intestine, cecum, ascending colon, transverse colon, then goes through the descending colon back here. And this part here is your ileum, or the last part of your small intestine. And you can see here the appendix it's a vestigial organ. It used to be really a part of your immune system, but not really. The problem lies if it gets infected with either a fecalith, which is a very hard piece of feces, or foreign body like a peanut or something else that you swallowed. If that gets infected, this might burst all the contents in there, which is has a ton of E. coli, which is not good. E. coli is good for you inside the colon, but outside the colon, it is highly pathogenic. Lymph nodes, spleen, thymus. Thymus, I want you to think of T cells. They're the ones that make T helpers and T cytotoxic cells. It's located in your throat area. Your spleen, located in your left upper quadrant. And lymph nodes, you have them everywhere. And you can see the lymph nodes. It houses like a little station, a way station for macrophage T cells and B cells. Okay? Don't worry too much about germinal centers. And the thymus is located here in the lower part of your pharyngeal area and the upper part of your thorax, right here. Okay, remember T cell production and what the T cells do. Spleen, left upper quadrant. It has red and white pulp. The white pulp makes white blood cells. The red pulp stores and makes red blood cells. The spleen can store up to 100 cc's of blood just in case of emergencies, but its main function is to filter out and recycle old red blood cells that live past 120 days. The different kinds of immunity is important. This will probably come out. Look at it differently. Look at it as innate versus adaptive. Innate, I want you to think non-specific. It's what you got at birth. So mucus, hair, skin, right? All of that you had at birth. And you have your neutrophils, basophils, mast cells. That's for inflammation, right? And eosinophils, which are for allergies and parasitic infections. And of course, natural killer cells. This is innate and they're non-specific. They attack like anything and everything. But remember, what's adaptive? The T cells and B cells have to be exposed to whatever you got sick the first time. And that means they adapt. Now, you could have adaptive immunity actively, meaning that you actually got sick, right? Or you could get it from your mom. That's why we're always promoting the colostrum or the first milk of mommy, because it has antibodies that are already developed. And of course, naturally and passively, I not necessarily synonymous, but they fall under the same category. And actively, you actively get sick, or we could introduce a vaccine to artificially, so you can adapt to the vaccine and then have some specific immunity. Remember, the B cells that make antibodies, those antibodies are only good for the thing that, or for the pathogen that you were originally exposed to. So let's say, for example, your B cells got exposed to coronavirus 123, right? Give you the common cold. Well, those B cells will only respond to coronavirus 123. If coronavirus 127 hits you, guess what? You got to get sick all over again and make more B cells. So think specificity, adaptive, T cells and B cells. All the stuff you were born with, right? Non-specific, that's including inflammation, form under innate or non-specific immunity. White blood cells, we already talked about neutrophils, basophils, eosinophils. Those are granulocytes because they have granules in them, right? And then you have the agranulocytes, which are macrophages, monocytes. Monocytes are actually precursors to macrophages. And of course, we already talked about the T cells and the B cells. We talked about innate. Part of the innate are your physical barriers. Skin, hair, exocrine glands or sweat glands, and mucus. Sweat glands also kind of filter out toxins. Have you ever went to a bar and you're not drinking and you're not smoking, but your clothes reek of alcohol and cigarette smoke? It's because you're breathing some of that stuff in, and then what did your skin do? It sweated all that stuff out. Mucus, of course, is a physical barrier in the respiratory tract to trap foreign body viruses and potentially harmful bacteria. Neutrophils, think phagocytosis, they're granulocytes we already talked about. Macrophage, they're monocytes that turn into big cells, macrophage, and these big cells, phage, eat. And that's the term phagocytosis. Cyte means cell, phago or phagio means to eat. Inflammation, of course, is innate, non-specific. Know your 5 cardinal signs of symptoms of inflammation, which is redness, swelling, heat, pain. So that's 4. Redness, swelling, heat, and pain. That's 4. And the 5th cardinal sign and symptom of inflammation is functiolacea. There will be, well, since there's damaged tissue, there will be a temporary shutdown of function in that area, hence the term functiolacea, or loss of function. So those are the 5 cardinal signs and symptoms of inflammation: redness, swelling, heat, and pain. And remember, itchiness and pain go together. They're the same type of muscle fibers. And last but not least, of course, functiolacea, or non-functioning area. Fever caused by interleukin-1, which is a pyrogen. So the function of a fever, once it's around 99 degrees Fahrenheit, a little bit over 37 degrees Celsius, it's going to give an uncomfortable environment for any potential pathogen. The problem is when the fever becomes greater than 40 degrees, and we're looking at 104, 105 degrees Fahrenheit, then it could cause seizures. It could cause even, coma. Because remember, your brain has an optimal temperature, and above 104 degrees Fahrenheit, it can't handle above that. So what is essentially a coma is when your brain does not like the atmosphere that it is in, so it will either temporarily or permanently shut down. Adaptive, we call T cells and B cells. Now, you have cell-mediated, of course, that's your T cells. And then you have your humoral or B cells. So think about how, to make a B cell. You get exposed to something, right? And then your B cell turns into a plasma cell, which is a memory B cell. And that memory B cell, that activated B cell, called a plasma cell, that will remember what it got exposed to and makes these Y-shaped proteins, and those are antibodies. And what do the T cells have to do? Well, remember that your T helper cell is an antigen presenting cell. So let's say this is the infected cell. Your T helper here latches on and then does what? It does two things. One, it calls their brother, their big brother, CD8+, which is your cytotoxic T cell. The cytotoxic T cell will then kill the thing that that your T helper was calling to go kill. Then after that fight is done, you killed off the first batch of bad guys, or the first batch of pathogenic antigen. Then your T cell sends a signal to your B cells to make what? Antibodies. And that's how it makes memory from a T cell. So these, even though this is B cells, antibody, also known as humoral immunity, and T cells, also known as cellular immunity, they're both related, and they both, in some indirect way, promote memory, or antibodies that remember what did you get exposed to last time, so you'll have a reaction to it quicker. We talked about active versus passive already. And you can pause on this and look at this slide. Adaptive, we kind of talked about that. I mean, not kind of, not my case. We talked about that, but here's some other some properties or medical terms that have to do with adaptive immunity, like specificity. Remember, your antibodies are highly specific. They, it's not apples and oranges like inflammation. Inflammation will react to anything, but an antibody will only react to what it's programmed to be reacted to. Specific answers versatility, that means, if I have antibodies for virus 123, 124, 125 to a million, that means I could potentially have multiple lymphocyte populations that have multiple specific protein antigens to fight specific things. Memory, of course, we already know that B cells, right? It remembers the first exposure and it's faster. And tolerance. Now, B and T cells, they don't attack your own cells unless it's unless there's an autoimmune disease thing going on. But that's not normal. Normally, your immune system will not attack itself. You can pause on this and look at this. More adaptive. You have a primary and secondary response. The secondary response tends to deal with immunoglobulins, and there's 4 or 5 at least basic types of immunoglobulin or immune proteins, which are all found in your plasma or the liquid portion of your blood, and IgG is one of those. Here's that Y-shaped protein that we were talking about. That's an antibody. And this is the variable region right here. This is the region that's going to be specific towards whatever memory that your B cells have of who attacked you last time. And these are the 5 classifications of antibodies. IgG, largest. IgG is like ubiquitous. That means it can kill viruses, it can kill bacteria, a whole bunch of things. IgA is also known as secretory IgA, so they deal with secretions like your tears and saliva. IgE stimulates basophils and an inflammatory response. I always think IgE, think of allergies, right? You spell allergy wrong with an E, that's IgE. IgD, sensitization, think hemolytic disease in a newborn, RH, blood incompatibility, and IgM specifically attack bacteria. Okay. You have also the 4 hypersensitivity. Think 1, think IgE, allergies or allergies. Type 2, mismatched blood. Type 3, autoimmunity. That means your body cannot recognize as itself, so it's going to attack itself. And type 4 is delayed. Typically is stuff like contact dermatitis. For example, like you buy a really nice bracelet on the street, right? And you think it's really cool, and then you wear it, and then a day later or a couple hours later, you start itching on your skin. So you can pause, knowing the 4, and delayed is the 4th one. Ooh. Here's more specific, but that chart is and this thing about delayed reaction hypersensitivity, 24, 48 hours, but I've seen contact derm less than 12, and it depends on the person. We already talked about autoimmune disorders. Autoimmune disorders are bad because I want you to think of your body attacking yourself, like in rheumatoid arthritis, or when you have IDDM or insulin-dependent diabetes mellitus or diabetes mellitus type 1, where your antibodies start attacking insulin for some reason. Okay, autoimmune, not good, because you have autoantibody. That means your body is doing friendly fire. It's attacking itself. Immunodeficiencies, of course, we already talked about the T helper cell and the cell-mediated T cell response. Well, think of if HIV attacks your T helper cell, then you don't have any T helper cells, you don't have any memory, you don't actually have any cellular active immunity, so that's not a good thing. Severe combined immunodeficiency disease, SCID, and infants, nice to know, but AIDS, HIV, more common. Infection control, we kind of know all these things already. And if you didn't, pause on this. Okay, and that is the lymphatic and immune system. And I'll be on the lookout for the next lecture.